The Health Subcommittee will come to order, brief opening statements, and then 2 panels, and welcome all of you for coming. This is the 3rd session of Congress in which I have introduced legislation to ban the practice of surprise billing. Today's bipartisan hearing represents an initial effort by this committee to finally offer some relief to patients who've been bearing the brunt of a dispute between their insurers and some of their health care providers. For patients, you can take all the right steps in attempting to see that your care and network is covered, but you may still face some really big bills. Indeed, 1 in 7 Americans have received a surprise bill as a part of receiving care at a hospital that is actually within their insurance network. The problem in San Antonio, one of the communities that I represent, has been so extensive that Jay Avila at WAI has initiated an entire television series called Show Me Your Bill. And I think a quick video clip from that adequately demonstrates the problem, and I'll ask that it be shown at this point.
2/3 of Americans say they worry about receiving an unexpected medical bill. A surprise bill you thought your insurance would cover. Tonight, News 4 troubleshooter Jay Avila is launching a year-long initiative to help you fight back. We're calling it Show Me Your Bill.
There are 2 main types of surprise bills. When you go to an emergency room that's not in your insurance network and they charge you for the portion your plan won't pay, or one of the doctors isn't in network, so you get a big bill from them. Then you get the runaround trying to straighten it all out. But starting tonight, show me your bill and we'll go to bat for you.
Lavera Vincent is a good example. She paid $750 a month for insurance coverage. One day she began suffering chest pain and says she actually called ahead to make sure the emergency room took her insurance.
I've got this cardiac issue going on, but I'm still going to make sure that I'm doing the right thing financially for me. And so they assured me that yes, I am in network.
But surprise, the Metropolitan Methodist Emergency Center in the Quarry wasn't in network. Neither was Northeast Methodist Hospital, where she was transferred for further testing. The total charge for 2 nights hospitalization, $31,000. Lavera's insurance paid only what it said was reasonable and customary, $9,700. Methodist Healthcare billed Lavera for the rest, $22,000.
I've never had a bill collector call me ever. And it's a horrible feeling.
Lavera says before it got to this point, she tried for 2 years to negotiate with both Methodist and her insurance company.
I felt like I was on a Ferris wheel. I was going around and around. I would get somebody and they'd go, oh, I'm not the person. And I'd tell somebody else my story. They would transfer me somewhere else.
So Lavera showed me her bill and asked for help. After several phone calls, I got a response from her insurance administrator, Allied National, who blamed the situation on the provider, Methodist Healthcare. The provider is billing Ms. Vincent their retail rate, which no insurance company ever pays. Most providers, when they take the time to look at the reimbursement rate, would be more than satisfied with the payment made by her health plan. So I contacted Methodist Healthcare, which said the insurance company was at fault. Ms. Vincent's insurance plan limited her coverage. Allied Insurance paid an arbitrary rate of reimbursement that did not appropriately cover the costs of services provided to Ms. Vincent.
Hi, how are you? It's so good to see you. Come on in.
At least I was able to go back and see Lavera Vincent with good news. Methodist Hospital says it has accepted what her insurance paid and canceled the rest of her bill. Instead of $22,000, she now owes nothing.
I feel so relieved. And I'm so grateful.
And I know she's relieved, but we can't rely on media exposure to solve these problems. She's also not a typical consumer caught in this situation. She served as executive director of the San Antonio Restaurant Association, and yet she had these kind of difficulties. Another example is Drew Calver, a public school teacher with health insurance from his school job. He received out-of-network care after a heart attack, and he almost had another heart attack when he got the $100,000 plus bill. Only after his story was reported by Ashley Lopez at KUT Austin for NPR Did he get relief? And some other people around the country, as the story got out, got some relief also. And Drew was recently invited to the White House to tell his story with the president. With unanimous consent, I'm entering his statement about his experience into the record. But as we move forward, we have some protections from the states that are being implemented. In fact, one that was approved in Texas last evening. But I think we'll hear that federal action is essential since in Texas, for example, 40% of insured individuals are insured under ERISA plans, and they can receive no protection from state laws. To address the gap in protection, the In Surprise Billing Act, to which I referred to, is designed to protect insurance patients from being trapped between an insurer and an out-of-network provider. It's the sole focus of the bill. Originally, that concept, when I first introduced it, faced a great deal of opposition. In Texas, for example, the only remedy until yesterday, and a bill that I think is not finally approved in the legislature, the only remedy offered was for the patient to negotiate directly with the healthcare provider in a little-known mediation system that has helped some but omitted many. Fortunately, there now appears to be a growing consensus, most recently joined by President Trump, that holding the patient harmless should form the foundation for any surprise billing proposal. Under the legislation that I advanced, patients would only be charged in-network cost-sharing rates in emergency situations. In non-emergency situations, out-of-network charges would be permitted only when the patient has agreed in advance after receiving effective notice regarding any providers and services together with estimated charges. No other bill addressing this issue has yet been filed here in the House, but there is a very useful discussion draft proposal that is being circulated on a bipartisan basis by the House Energy and Commerce Committee, and there's several proposals that have surfaced in the Senate. While every proposal currently begins with the basic premise of the In Surprise Billing Act, conflict remains over how to resolve insurer-provider disputes, and that's what we'll hear about today from those that have the most direct stake in it. Our Health Subcommittee hearing has been organized on a bipartisan basis to hear what they have to say, to see if we can find ways of resolving that dispute, but my primary concern remains to ensure that nothing stands in the way of federal action to remove the patient from being in the middle of a dispute that the patient can't control. The leading proposals have pros and cons that we'll hear about, and I think that while condemning surprise billing, President Trump has rejected two principal approaches, one for arbitration and one for rate setting, and it's unclear exactly which proposal he supports, but I think his support is very important to resolving this. The administration has raised the possibility of bundling payments as a solution, and we'll hear comment about that today. I basically support any solution that can get 218 votes here in the House and protect patients, gain Senate approval, and his signature. And I look forward to the discussion that we'll have today to identify points of agreement so that patients no longer bear the brunt of this dispute.